Live.
Okay, so we're here. We're doing a shave. I call it a shave C&D, but Dr. Lewallen, you call it something else.
I call it electrodesiccation and curettage, so an ED&C.
Electrodesiccation and curettage.
Yes.
It sounds bougier the way you say it, but basically what you're going to do is last 2 weeks ago we did a skin check.
Yeah.
Which you guys, Dr. Llewellyn's great. She's like, Kerry, we got to get you back in. And just like you, I don't like doing them because she more often than not finds something. And I had this kind of like these few things that I was like, okay, this could be something, this could be something, this could be something. And she looked at all those things. None of those things were really anything to worry about. And there was another one on my wrist that I totally forgot about. And she did 3 biopsies, which is kind of a lot for me. And she was like, I said, well, what do you think they are? She's like, I think this one is a basal cell carcinoma. I think this one is a squamous cell carcinoma. I think this one is a squamous cell carcinoma. But the one she's doing right now was actually a basal cell, but she didn't do a, what do you call it again?
I call it electrodesiccation and curettage, so ED&C. And then you call it a C&D, so you call it curettage and desiccation.
Thank you, Dr. Llewellyn.
Yeah.
So she did the curettage and whatever on the 2 other sites, and she was right because she's a rock star. She was also right on this one, but this one had a pigmented lesion attached to it, so she was concerned that it could possibly be a melanoma. Thank goodness it was not a melanoma, because those things are mean, nasty, and we don't like those at all. And I haven't had one yet. So she's going to treat this right now. And you guys can watch. Dr. Llewellyn,
Yeah.
how did I do? Did I cover it?
Yeah, so I don't know how well it can do the photos, but we did the pre-biopsy photos. So this one here was the one on the back of her calf, and that one was a squamous cell. So at the time of the biopsy, we actually did what Kerry calls a C&D, or a shave C&D. So we treated that one at the time of the biopsy. This was the one on the wrist that she was mentioning. She tried to hide it under her watch, but unfortunately I still saw it. And we biopsied it, and it was also a squamous cell, but we treated that the day of the biopsy. And then this is the one that we're doing today. It was on her back, and this was the pre-biopsy photo. You can see she has a lot of pigmentation on her back from kind of sun in the past. She's very good with sunscreen now. But because I had so much pigment, I didn't want to do the procedure the day of for this one, just in the off chance that it is a melanoma, because she does have a family history of that. So that one is the one we're treating today. And there's the biopsy site, so we're just going to be treating that.
And then we can look at, this is the one on my wrist now, so 2 weeks later, that's what it's looking like, you know, on its way to healing. Of course, I can't wear my watch anymore because it kept zinging it. And then the one on the back of my leg, honestly, I had no clue it was there. This one I knew was there, but I kind of forgot about it. The one on my back that she's doing, I call C&D, but she's doing that treatment on right now, I had no idea was there. And so Dr. Llewellyn, you know, let's say I didn't get it treated. You know, I didn't come in, I didn't see you for a skin check. What happens?
A little picture. So this one was a basal cell, and it's actually a pigmented basal cell, which is why I thought it had a lot of pigment in it. And these tend to double in size every year until the point where you would start to notice it, because it would start to ulcerate and bleed, but it'd be pretty big by that time. And then you would definitely have to have a surgical excision with stitches if you waited to the point where you would be able to notice it.
Mm-hmm.
So instead, we can just do this, you know, little gentle scraping to treat it, and then no stitches, no downtime. You can go back to your regular activities. You really just have to avoid, you know, water submersion to the area. So like no swimming until the scab heals. But otherwise, you know, it's much easier than if we had to excise this area with stitches, because then you wouldn't want to do the gym or exercise, and a lot longer downtime.
Well, and I have to say, like, not too long ago, I had 2 excisions done on spots, like, I think they were both squamous cell carcinomas, but much bigger deal than this, you know, this procedure right now. Not awful, I wouldn't discourage you from doing it, but if I had the choice between doing this, what you're doing right now, and the healing and doing the sutures, like, it's a big difference. So.
And especially those other two that we did the day of your office visit, it's kind of like you just healed from the biopsy. It's just a little bit bigger of a scab than the biopsy site.
Right.
So you didn't really even have to heal twice. You didn't have to come back to do something again.
Right.
So it's nice when we can do that if they're early. And we do skin checks on you really frequently because of your history. So we're able to catch things early.
Mm-hmm.
This is the electrodesiccation part. The curettage is what you just saw, and that's the electrodesiccation.
Do you feel anything?
No, because the only thing that hurt was the numbing. And then there's no pain at all. And so recovery from this, like you said, no swimming, no jacuzzi until it has a scab. And then we're just going to cover with a bandage, right?
Yeah, it's about 2 to 3 weeks. And then just a bandage and some Vaseline. And then that's pretty much it.
All right. So, and I'm back in business for another couple weeks until something else pops up, right?
Yeah, until your next skin check.
Yeah. And then let's talk melanoma. Had that been a melanoma, what would we be looking at?
Yeah, so I can kind of do a little example. If you can give me a marker, Alex, I'll show kind of what we'll be talking about the difference. So, for example, if this was a superficial basal cell, so it's very early, so that's why we can do this type of procedure because it's not very deep. So you can just do a little scraping like this. If this were a invasive basal cell, or what we call a nodular basal cell, we usually do about a 4 millimeter margin of normal skin, which is about that big. So that's how much you have to remove to ensure that you safely got it all. And then you would close it, and it would end up being, about that long, a linear scar. So if you waited until, maybe a year from now, you'd be looking at that, okay? If this was a melanoma, we have to do 1 centimeter margins, which is about that big. And then you have to close. So then you're looking at a scar that's like that, from here to here. So the type of skin cancer it is tells you what size margins that you have to take and how to close it. So that's what we'd be looking at for each of those different types. But because she comes frequently and we catch things early, she has just that little scab instead of anything with stitches.
So you're not telling people to come just so you make more money?
No.
Really?
No, definitely not. I am certainly busy enough that I don't have to have people come and do it to make more money. Actually, I make less money if I could do this. I would make more money if I did that. So if I excised it, you technically make more.
I'm smiling right now. You guys can't tell because I got the mask on, but honestly, I do sometimes have people that suggest that maybe, we're doing things a certain way because we want to collect more money, and maybe I don't think that's true in 99% of offices, but especially I know for a fact that's not the case here. We're really trying to care for our patients in the best way possible for their health, not for our wallets.
Yeah, for this, for example, this one, I would much rather do this to somebody and do a little tiny procedure and cure the skin cancer this way than have to do the scar and the downtime and the no exercise and all of that. It's much better to do a little tiny procedure and get it cured than wait to come in before, Kerry had no idea that was there, so,
It's really hard for me to see my back.
She wouldn't notice that was there until it was pretty big, typically. They usually start bleeding before patients notice anything.
All right. Well, I think that was very informative, educational. Kicking it with Kerry. Dr. Lewallen, as always, a pleasure. I really appreciate having you. And thank you for taking such good care of me.
Oh, you're welcome. My pleasure. You're all cured. Cancer-free.